My name is Jill Ross, and today we're going to talk about diabetes, including what it is, what causes it, how you treat and monitor it. I'm sure most of you know at least one person that is affected by diabetes, but what do you really know about the disease? What are your risk factors for developing diabetes? There are many causes and complications of diabetes, many ways to manage the disease. According to Weight Watchers magazine, diabetes affects 13 million men and 12.6 million women in the United States. Women are more likely to suffer from its deadly effects. Glucose is a simple sugar in your blood and your body's main source of energy. It comes primarily from carbohydrates in many of the foods you eat, including sugary treats, starchy vegetables, and grains like breakfast cereal. Having diabetes means that your blood glucose is elevated above the recommended levels. Glucose is a large molecule that causes damage to nerve endings, blood capillaries, and causes blindness, nerve damage, nerve pain, heart disease, stroke, hardening of the arteries, and many other issues, including and up to amputations. Without aggressive monitoring and lifestyle changes, complications can lead to decrease in ability to function without assistance and a slow, painful death. I'm going to help you recognize the signs and symptoms of diabetes and help you monitor your glucose levels. Let's talk about causes, symptoms, and monitoring diabetes. First, we're going to talk about the causes of diabetes. Diabetes can be caused by a number of factors: family history, autoimmune disorders, viruses, age, obesity, lifestyle, and inactivity. It's important that you know your family history and how vulnerable you are to this disease. Next, we're going to discuss the symptoms. How do you know if you have diabetes? According to Teen's Guide to Living with Diabetes, you may have diabetes and not know it because you don't have any symptoms, or the symptoms progress slowly and you don't notice them. Symptoms of prediabetes and diabetes include unusual thirst, frequent need to urinate, blurred vision, fatigue, and unexplained weight loss. Managing and monitoring your diabetes. Diabetes can and should be well managed without complications. This can be done by adopting a regular exercise program, limiting calorie, fat, and carbohydrate intake, and monitoring your glucose levels, and taking your medication as prescribed by the doctor. According to the Diabetes Answer Book, good glucose control is when you can keep your average blood glucose levels close to the normal non-diabetic range without letting it go too high or too low. That brings us to another question. What is a normal blood glucose level? The Diabetes Answer Book states that a normal glucose range is between 70 and 100. I'm going to demonstrate how to check your blood glucose. This is a meter. We have test strips and a lancet. You take a test strip. There's multiple different types of meters, but they all work basically the same. You're going to put your test strip inside your monitor. Take your lancet, prick your finger, and blood will come to the end. And start testing your blood. It's going to count down. 5, 4, 3, 2, 1. Today my glucose level is 85, which is very good. If I had recently had a lot of different desserts or something, desserts is my favorite, it would have been about 140. But I'm usually in the normal range. These test strips can be bought at any drugstore or pharmacy. But if you have any of the symptoms we spoke about, it's important that you get additional testing by your doctor. To summarize, we've learned about the basics and causes and symptoms and how to monitor your glucose levels. It's important that you find out your family history and begin living a healthy life to ensure you do not become a victim to diabetes. Thank you.